Welcome back to Morning Break and this week's Brain Matters segment with Dr. Randall Gates, board-certified chiropractic neurologist and chiropractic physician. He is with Gates Brain Health, as well as Advanced Imaging Reno, which is actually where we're going to start talking in our segment today, because you guys have now been open for 3 months. How's it going?
Wonderful. It's been amazing. The findings we've had have just been astounding. One example would be whole body MRI. So when I got into this, they said that 1 in 20 whole body scans had a life-saving diagnosis, which seems like a lot. And our ratio is way higher than that. So maybe it's early, maybe our sample size is not as big as it will be in a year, but it's been astounding the things that we've come across.
That's amazing. And so I think one of the big questions that a lot of people, you said it, have had is, you know, when they get their MRI scan, what do they do with it? Who's reading it? Who's helping them interpret it? Great question.
I think because, because I have an ownership interest in Advanced Imaging Reno, a lot of people think I'm the one reading the MRI, which is not the case. We send it off to board-certified radiologists, and they read the films, and then we get them back, and those films are then sent to the individual's doctor and the patient
and
with the radiology report.
And you've already mentioned that, you know, you're providing life-saving diagnosis, you know, and I'm sure that's a component of your mission. But if you were to kind of summarize what your hopes and goals and mission for the Advanced Imaging Reno is, what would you say?
I would say that we're really trying to change the environment with MRI. One of the main motivators for me to get into this was that patients can wait a month, 2 months sometimes to get an MRI, and it's a lot of waiting, and I want to make things efficient. So one of the cool things with this new MRI machine that we bought is that it's really fast at scanning. So we can do a lot of routine exams in 10 minutes, 12 minutes, right around there. So we have the ability to see more people, see people faster, and we're here for the community. So we're here to help, and people, the more, even if you don't need an MRI, if you can spread the word to other people who may, you know, be in line to get an MRI, if people don't want to wait, we're that option.
Yeah, and while Advanced Imaging Reno really is focusing on kind of whole body scans, we want to talk now about brain density scans.
And I actually want to say on that point, we do everything.
You do everything?
Yeah,
oh,
so
perfect.
we do knees, we do ankles,
okay.
we do necks, low backs, we do brains for sure, and we do whole body. So we do a lot of things.
Okay, no, I'm so glad you said that.
Exactly. And when I got this MRI machine, I got the software to do all the fancy brain imaging that we've talked about. But yeah, we can really do everything.
And brain density scans, you think that this should become like a standard practice of care within the healthcare system because it can tell us so much about our health, right?
Exactly. Just like bone density is so important. We do DEXA scans for bone density. Why aren't we doing brain density scans?
I don't know. You tell me. You're in the industry.
I know, exactly. Well, there probably are other reasons for that. But I propose that everybody should be getting a brain density scan, particularly if there's any risk in the family or any history in the family of a memory loss condition. If there's any history of playing contact sports, which could be football, soccer, fighting, boxing, things of that nature.
Okay.
I think it's really, really important.
Especially like if you get it before you even start seeing strong symptoms, that something might be wrong, because that gives you that kind of like, I guess, like your base layer almost.
Exactly, and it gives you can do it at that time where there are modifiable changes that we're seeing in the literature can dramatically impact the course.
Yeah, and now we've got 2 videos that we want to show you guys at home that are 2 different types of MRI scans. So the first one is our standard MRI. This is one that a lot of people can give, right? What is this one?
Yeah, the first one is your standard MRI. So we're scrolling up through the brain, and that's the gray and white matter. Most people don't even know what an MRI looks like. So that's why I want to show individuals. That's your standard MRI.
Okay.
As we go up through the brain, the view on the right is of a sagittal section. So
okay. And then the next video, this is what you call your volumetric MRI.
Correct. So you'll see the colors a little different. So this is a different type of software that's looking at the density of each area of the brain, and then from that we get metrics that we can compare to like 5,000 age-matched normal. So then we get the graph on the right-hand side of the screen that tells us how dense each area is.
Interesting. And then when you know how dense certain parts of your areas, you can almost develop almost like a treatment plan, whether it's changing your diet or changing your exercise or looking into other kinds of treatment and medication.
Exactly.
Interesting. It seems really simple.
Seems simple, but it's not being done. By and large. So that's why I'm proposing we need to do this. We need awareness around it, even if someone's 70 years old and they're starting to lose their memory, they don't want to do something about it. Lots of times it's their kids who are really concerned, because lots of times it's all going to fall on the kids.
Yeah, yeah.
So
genetics has a big part in a lot of these kind of diseases.
Especially memory loss, yes.
Yeah, well, good to know. Well, thank you so much, Dr. Gates, for being here. We really appreciate it. Both all of his information about Gates Brain Health and Advanced Imaging Reno will be on our website, kolotv.com, after the show. All right, we'll be right back.